We have a very interesting panel today. 4 companies. Each one of these 4 companies has international businesses, and they're very much inclined into the medicinal side. So we will introduce one by one. Jay Frankovic, chairman of the board of ST Brands, also sister company to ST Therapeutics and ST Biosciences. He will present it more himself as well. Alvaro Torres, CEO of Chiron Life Sciences, one of the biggest companies in Latin America, based in Colombia. Antonio Costanzo, CEO of Curaleaf International, ex-CEO of EMAC, which was just recently acquired by Curaleaf. And Oren Schuster, CEO of IM Cannabis, which can be considered the only MCO with Israeli-based patient clinical data, one of the biggest at least. So it's an extremely interesting panel. How are you doing, guys?
Doing well.
Great, thank you.
Perfect, great. So let's start with the first question so we take advantage fully of our time here. Let's talk about the biggest challenges that each one of you has faced, expanding internationally. And we know that despite the 2018 Farm Bill in the United States, or also in other international countries, hemp has been used all over the world, but CBD is not really legalized, right? It's like in the gray space, kind of purgatory. So let's start with maybe Antonio. Do you want to tell us your point of view?
Sure. Thank you, Claudia. And again, very happy to be here. Thanks for the invitation. And hi to everyone. So the biggest challenge I think that anyone has when going international is navigating regulations. In this industry, as we all know, regulations are not uniform. They differ from state to state in certain instances, like in the US, or from country to country, for instance, in Europe. And they differ if you talk about medicinal cannabis or if you talk about CBD wellness products. And so specifically to your question, Claudia, if you look at Europe, which is the continent that I'm more familiar with because I've been developing EMAC, now Curaleaf International, in Europe, the difficulty has been that every single country, despite having some common standards and principles on the manufacturing side, had a different approach to how patients could access medical cannabis and had a different or slightly different interpretation of the rules around CBD products. So today, still, when it comes to wellness CBD products, we are having to deal with different approaches by different regulators in Germany, in the UK, in Italy, in France, which cover a number of regulations, European regulation, but also local regulation. So that is the biggest difficulty that we found, and I think it's common to everyone who's gone international.
Thank you. I have to unmute myself. I actually have additional questions on that subject, but let's jump to the next one. In what ways do you, each one of you and your companies, differentiate your business model from other cannabis companies and competitors? Obviously, everybody has an edge, a different approach. I would like to start with Jay because I've been working with Jay actually in the past couple of years, and in one of his 3 companies, which he can actually explain a little bit, each one of them, he's approaching everything a little bit differently. What are the benefits of having the drugs derived from compounds that are synthesized from the plant and not from the plant itself?
So, Claudia, we take an approach where we don't believe it's natural versus synthetic, but instead giving the patient the option of choosing either the RX route or the natural route. And it's helped us navigate, as Antonio said, some of the challenges you have inside the CBD space. For example, Australia, the UK, Brazil. I'm currently in Barcelona, which, Spain is one of those places inside the European Union that did not hold up the what came out of France with the case in regards to CBD being able to product to be sold. So, it's challenging to navigate. So we look at it from 3 approaches. We take the RX route. We run preclinicals going into trials as well. We look at it from the natural approach, but putting science behind that approach and taking true tox studies and really digging deep into the science behind putting out these products. And then one of the advantages that we have in the consumer goods side of the business that we run is that we basically focus on non-competitive products. So we have one beverage company. We have one edible company. We have one company that focuses on skincare. And what we do is take those products that have been successful inside the United States and then open them into a larger platform, globally, whether it be in Asia, Europe. We love the South American market, think it's going to be a really hot market once COVID starts to settle down. So that's the approach we take. I think you can't just look at it from one approach, but I think that you do need to look at it from every aspect if you do intend to grow your business.
Right. As a matter of fact, what about the novel food requirements, which just started now in Europe, I guess, a month ago or so? Would that be compliant to those new requirements, the CBD hemp, products inside ingredients inside any type of finished products, right?
Yeah, well, I think it's, once again, coming from a drug manufacturing approach and putting together drug master files for the FDA. When putting these dossiers together, whether it be for the UK, Australia, or Brazil, you really need to know the protocols in putting those packages together and submitting them and following along the line of, taking the scientific approach to putting this product out, which, once again, it's considered in some countries still a narcotic, no different than THC. So, navigating those inroads is super important if you want to take a global approach to this industry.
Okay. Yeah. Still on the topic of how you differentiate yourself, right? Antonio, we're going to talk about Europe, as we said, but let's compare a little bit of, how certain products have been launched by Curaleaf in the US market. Select Squeeze was just launched in, I guess, all 14 states. And I think Boris last February during the conference, he was announcing this launch and saying it will come at the same time in all our states. That's how Curaleaf does it, right? So how are you going to do it in Europe? On the other hand, UK, Germany, Italy, Switzerland, Portugal, how would you launch new products? In what manner?
Again, you have to differentiate between medical cannabis and CBD wellness products that do not require a prescription. So when it comes to medical cannabis, you can use the same product or almost the same product in different countries in Europe. You need to go through, in certain cases, registration processes for those products. In other cases, you have to submit a big amount of documentation on the safety of the product. And you have a different approach to how the product is prescribed. In certain countries, you need a specialist who will prescribe the product. In other countries, it's any GP that can prescribe the product. So again, it goes back to the point, you need to be aware of how the different countries are enforcing medical cannabis programs. Or on the CBD wellness side, to the point of novel food. Novel food, has been around for the better part of 1.5 years now. We have 2 applications that we have submitted with 2 different partners. One has been already validated, which doesn't mean approved. It's validated. It's the first step. Then you go through the approval process. It's going to take some time, but we're going to get to the point where we have a product that can be used as an ingestible product in every single country in Europe. So I'm repeating myself. I'm probably boring people, but it's all about navigating regulations.
I think also Jay was saying similar. This is the way of doing it. Thank you so much, Antonio. So I'm going to switch this question, actually still in the same subject, which is how do you differentiate yourself, right? To Oren now. So I was studying a little bit of company, which is obviously I'm very interested in anything that comes from Israel. So as of right now, I mean, a couple of months ago, in April 2021, you acquired Israel's largest retail and online pharmacy business, Panaxia.
Yep.
But you've also made other acquisitions to secure a vertical position, right? With cultivations in Canada, like Tricom, MIM, Sublink Culture. What is your business model? What are you after? Do you want to supply Europe? Do you want to supply other countries, continents?
So IMC, as of now, focus mainly in 3 countries, which is Israel, Germany, and Canada. And Israel and Germany more in the connection of the EU market, which is our main focus. So IMC started has been one of the pioneers in this industry. And you asked about how we different, what we're doing different. Okay, I will say it like that. So I think that the fact that we started from a very medical market and we supplied for many years directly to patients enable us to collect a lot of data, clinical data, and to validate this data along the years, because we've done it for almost 10 years. So we had the opportunity to know exactly what kind of strains we are giving to the patients, what indications those patients have. And in the medical market, we have done a lot of that. We collected a lot of data, and the Israeli market is very medical and research oriented. So I think that today we know about our strains, to what indications they are helping, what patients reported on each of the strains. So it's very easy now to use it and to help patients to find the exact strains that they need. I think that this is something very unique. It's super relevant in Germany, for example, where we are active, because it's a medical market and doctors want clinical data. So I think that this is a huge advantage that we are bringing to the medical market, at least.
Absolutely, yes. And Germany is leading kind of regulations in Europe. So Europe is only medical at this stage. Okay, great. Thank you. Now, next question. With legalization happening in so many countries at the same time, right, across the world, which markets or countries will you prioritize in the next 2 to 3 years? So I would like to start with Jay, because he has 3 companies, different countries, and I've seen him actually put this together in the past few years. So I would like for him to describe where the operations are, which countries, right? And when you touch when you start talking about United States, also, how do you deal with current interstate commerce within the United States?
So, our platform reaches from North America, South America. We're in Europe, Asia, and working on submitting a dossier right now to help out the 2 of the 3 license holders in Australia. So, we really take it from an international approach. And once again, I really focus on the science aspect of it. And I think, having clinical data to go to specialists is key, because, look, the United States and Canada have established markets. As you start to go into markets, Europe, for example, Germany, Poland, when you do, or the UK, when you have specialists, they're going to want to know basically who ran the trials, where the data was collected. So you really need to focus on that, because it is a drug, and the markets are different. It's not the same as entering the US market. And, for us, we started out in the cannabis space in the US, but kind of pivoted in the United States. We only have 1 asset, which is a DEA approved laboratory that we work in, and kind of transitioned into the CBD space there, where, interstate commerce was easier for us, right? So, we like the markets that are difficult to get in, right? Because if you have good SOPs in place, you'll have the ability to get there. And look, this isn't a business where you jump in and make money in 6 months. You've got to be able to stick out, 2 to 3 years of getting into the market. And the thing is, sometimes first to market is not always, and I'm not going to say not always, I'm going to say it's probably not the best position to take. Sometimes coming in, second, third, and fourth after that guy's broke the ice is the way to go. And, we like those markets. Brazil is one of them. Australia is another one. So like I said, the more difficult it is, the better it is for us to really put those SOPs in place and get into those markets. And those are the ones we like. So that's, that's the future of where we see the business in these bigger markets.
Thank you so much, Jay. Actually, I think I should ask this question a little bit to everybody, because the investors, the audience wants to know where each one of these companies are expanding. So next, Antonio, which market country are you thinking of, expanding or developing more operations in the next 2-3 years? Or go ahead, thanks.
So Curaleaf obviously, started as a US company and is still the main focus of the company. So the US will remain the main focus for the group. Clearly, with the acquisition of EMAC and now Curaleaf International, there is also a focus on expanding internationally, in particular in Europe. And when it comes to Europe, the biggest markets are Germany, the UK. We think that Italy and France are also going to develop in the next 2 to 3 years significantly, and that's on the medical side. And on top of that, we believe that certain countries will start to legalize recreational use in Europe. There is a number of ongoing political processes that are happening in certain countries. I can name the Netherlands, Switzerland, Malta, Portugal, probably Germany, possibly Germany after the elections in September. So we think that trend is happening, and we're going to see it moving forward. And those are the focus. That is the focus that we will have in the next few years.
Okay, great. Actually, a side question still to Antonio, okay, quickly. I know we talked about Europe and Italy as well. Which countries in Europe, European countries, do you think would be the best market for medicinal cannabis treatments or nutraceutical over-the-counter, versus which European countries will be more advanced politically for recreational legalization?
So legalization of rec, as I said, there is a number of countries that are currently looking at that, and it's the names that I've outlined earlier. If I had to guess who is going to go first, so first of all, we know for a fact that the Netherlands and Switzerland have implemented or are implementing some recreational pilot project, so that is happening. In terms of full legalization, if I had to place a bet, I would probably pick Portugal as the first country that will go full rec in the next couple of years. And when it comes to over-the-counter or CBD wellness products, it's anyone's guess. UK today is the largest country in terms of CBD sales in Europe. Germany is not far behind, is following suit. If in Europe, if you bet on the 5 big countries, UK, Germany, France, Italy, and Spain, you're normally betting on the right countries.
Now, Alvaro, tell us. We know a little bit about your expansion plans in Latin America and Europe as well. Tell us which markets, countries you want to develop more in the next couple of years.
Well, thank you, Claudia. Our approach, particularly in Latin America, is a very vertically integrated approach. So we cultivate in Colombia low cost, very pharma grade type of products, and then we have our own health centers and our own clinics, and we prescribe to our own patients. And that's the growth that we've been having, very exponentially, even with the COVID situation. I think for this year, particularly LATAM, we already started in Colombia. We're growing very fast. We started our first clinic in Peru this week, and having our first patients. And certainly the approach of taking our clinic Serenia all the way Latin America is going to be one that we're going to be doing this year, particularly in Mexico and Brazil, second half of the year. I think, I don't remember if it was Antonio, it was Oren who talked about regulation. I think also access is very important, when you talk about these markets and educating doctors, educating patients, which is why, in our case, at least vertical integration plays a big role, because we're able to get those patients. And as Oren was saying before, it's really all about the data, and it's all about how to convince I mean, when we think about medical markets, particularly Latam and Brazil, all these countries, there is a lot that is not known, right? And there's a lot of expectation from doctors on how do you train them, what type of education, what type of how do you show them the evidence. And so for us, having those clinics and having the ability to have access to the patients, access to the insurance, because in Colombia we got insurance coverage for medical cannabis since December. We just got our first patient in Peru with insurance companies, and the more data we can provide, not only from a health perspective but also from a economic perspective to insurance companies. And I'm sure like what Oren has been doing in Israel, that the more we can do that, the more access we open. And the more access we open, the more this market will develop. I think that's what we're taking for Latin America. For Europe, we're focused on UK and Germany. We just started sales. We're just in that process. We're not there yet, or at the position that Oren and Antonio and Jay probably are. But I think what we're also taking is all this information and all this data that we're able to gather directly from the patient, because we've seen more than 10,000 patients with medical cannabis. How you start showing doctors that you're switching pregabalin, buprenorphine, morphine, tramadol, and you're able to make a different use of medical cannabis and start breaking down those barriers, the more of that data you're able to collect. And I think, if I may speak on all of these studies, the more the companies are able to do that, the more access will improve. Right? This market will be developed by several companies who need to break those barriers. The opportunity is huge. I think for us in Latam, certainly we've been leading the charge. Hopefully more companies will follow to try to break those barriers. But when I think about Mexico, Colombia, Peru, Brazil, UK, and Germany, I think that's enough on the plate. And even just in Latin America, I think about Mexico and Brazil, it's two huge markets that is all going to be about how do we bring more access and how do we make more patients. And the more that we develop in Colombia, the more that will continue to show in the rest of Latam.
Yeah, as a matter of fact, you touched something very, very important, Brazil and Mexico. So Brazil, over 210, 11 million people. Mexico, over 130 million. Mexico is getting federally legalized at the moment, hopefully by this year. It's in the hands of the Senate at this point. Brazil, totally conservative, but back at the beginning of 2020, I guess they approved guidelines for import of medical cannabis. Now, I know from analyzing kind of life sciences reports that currently you guys are operating with the authorization for compassionate care imports. Will you obtain the sanitary authorization with Anvisa? Because the problem with Anvisa is they don't want only EU GMP certification. They want this 12-month stability testing for humidity over the shelf. I was learning everything about it. It's crazy, right? So what will you do about it?
Well, I think, first of all, the more quality is required, and I'm sure everybody would agree, the better, because we need to make sure that patients are safe. At least from my perspective, a safe product is always very important, particularly when you're talking about a conservative society in Latin America. That's, at least particularly from my point of view, we've seen cannabis, we've always been the illegal growers of marijuana, right? So when you want to switch into medical, you need to make a difference with black markets and such. But yes, we're starting Brazil with that compassionate care. We're going to have our first patient soon. For us, we're doing two things. It's also on the production and yes, the registration with Anvisa, but also on the access and the clinics. Because I think that without that part of the equation, it doesn't matter how many products are going to be there, because patients need to know about it and patients and doctors need to know. I think the one thing about Brazil is it's a very exciting market. When it comes to CBD, the labeling is a lot easier. When you talk about THC or one-to-one, the labeling restrictions that are on those products for registration are going to make it very more harder to try to position brands, which is why access matters a lot when it comes to patients and access. But yes, we're on that track. I think there's it's a huge market, 250, 220 million people, and it's not just one big market. You have to think about different cities. Sao Paulo has 30 million people now, so yes, that one city is as big as Brazil, Canada. Sorry. So I think if you continue about market, there's the registration is getting of course, more complex. But I think that's just also part of the story. I mean, look at when Canada started. None of those quality controls were in place when Canada started, 12 years ago. And maybe that helped grow the industry. But the more we know about cannabis, the more we know about stabilities and those type of practices, I think the more safer patients will feel, and the more safer doctors will feel to prescribe. And I think that only works to build a real credible market, because in the end, you're really trying to compete against, in some conditions like chronic pain, with opiates, and you have to take that quality to that level.
Exactly. We hope that happens very soon. Oren, the next 2-3 years expansion, which country, which region, which market?
It's a very good question. We just had an election in Israel, and it seems like the new coalition have just announced that all the parties signed that they're going to legalize cannabis. So I think that assuming that this government will form, then we will know it in about a week. So legalization will start very quickly in Israel, I believe, because there is a very strong support. Now, Israel is like Michigan, if you take the numbers, so it can be a significant market. It's not an easy market for foreigners to come into this market. It's very different. So I think that we will have very strong focus on the Israeli market in the coming years, because the market, the potential is huge, and we are already solid in this market. So it makes sense to take a leading position in an emerging market like this market. We are definitely focusing on the German market now, and like Antonio said, I think that in Europe it's very simple. If you have the few biggest countries that you are watching closely, you have an excellent overview over the continent. And Germany is the most populated country and the most advanced today with the medical program. And I think that also even the toughest regarding regulations. And I agree with everything that has been said. What is setting the business today is the regulations. So we went to the most difficult place. It's much easier to go to other places in Europe. I think that Germany will see significant change in the coming years. And I think that, like Antonio said, I completely agree. We can see that some countries have started the legalization process. Some are in a pilot program, like there is in France, the UK. It's all over the continent, actually. So definitely the EU is the main focus for us in the coming years.
Amazing. And the legalization in Israel is recreational?
Recreational, yes. So they just announced about that. All the parties in the coalition have signed, and the most diversified coalition that ever been in Israel. You have all the society of Israel are represented in this coalition. So I think that it's a very good sign that you see that all of Israel want legalization. And Israel is considered to be a conservative country, relatively, because we have mixed population.
Absolutely, yes. But I heard, and I didn't study that yet, but I heard that Morocco and Lebanon gave some form of legalizations as well, right? So in the Middle East, Mediterranean areas, there's a lot of movement.
Yes, that is correct. And also, I would say the African continent altogether, because you mentioned, so in Morocco, there is the law passed the first, I think it was the House, one of the two. So I think it's in the House and it has to go to the Senate now. South Africa is also working on legalization of recreational and medical, both. You have other countries in Africa that are trying to take advantage of their climate in order to become a hub for cultivation and production of the raw material or the flowers to then be exported. Obviously, the difficulty there is meeting the standards that are required in certain countries, and in particular in Europe, which is not always easy. But clearly, that secular trend towards the legalization of cannabis is happening everywhere. I would also include Asia. I mean, Thailand, decided to also legalize hemp and products derived from hemp. It's a major first step. Japan just announced that they're going to be allowing medical cannabis or medical cannabis products into the country, which again, a major step. So I think in the next 10 to 20 years, those of us who are still in this industry will be witnessing an amazing development, an amazing growth trajectory across the globe.
Right. What about Muslim countries?
It's funny you say that. There will be an announcement in the next coming weeks with one of the Gulf states, coming out with a medical cannabis program. So it's, once the Gulf gets on board, I think that was the last barrier to entry. I mean, it was Asia was difficult, but as Antonio said, Japan, groundbreaking, and news out of the Gulf is coming, and it's big for the industry to see coming out of a country where super strict programs. There'll be no legalization of recreation, I don't think, in the foreseen future in the Gulf. But look, medical program is a start, and it's a big start for this industry there. So.
Yeah, I think, by the way, that in Israel, we are a mixed country. So now in the coalition, the Arab party, the big Arab party, signed pro-legalization, not medical legalization, full medicalization. And, today, the Arab community in Israel, the Muslim Arab community in Israel, is part of the medical program. And you can see it also in Muslim cities, and people are using medical cannabis as a treatment.
That's amazing news. Also because it's been used in recreational matters over there for a long time. But actually, let's talk about education here. How do we get some countries like, Antonio? We also have Italy. We know that it's decriminalized and medicinal is legal, but in reality, most of the population don't know about it, right? And of course, Alvaro can tell us a little bit about, he has experience on, building on this extensive network of clinics and partnerships with pharmacies where you actually provide education and training. But how can we, get this knowledge base to as many people as possible, so that also our moms or our, older people can say, oh, I'm going to use this treatment instead of only relying on chemotherapy, for example. Anybody who wants to add on this, any of you guys?
If I may start, Claudia, at least from the perspective of Latin America and Colombia, I think the conversation is getting a lot easier, a lot better. For example, this month we partnered with 21 clinics all across Colombia, and we launched a national coverage campaign offering free consultations for cannabis all the way from the north to the Amazon jungle. Some things like that have never been done, or you couldn't think about doing something like that a year ago. And the reason why, even today, we're already on those 3,000, 4,000 consultations, that's already filled by almost 50% in the first 2 days of June. Because the more people start talking about the stories that are being published on Instagrams and people talk about the real experiences, the more people start to say, well, this is a good medication. And yes, there's patients that are, taking a lot of medications and trying to find a different alternative. This type of access program that we're doing in Colombia, we're going to try to do all across Latam, but also the type of things that you couldn't think about before, and be able to have with the media and partners with the media. So the big TV chains or networks are starting to talk about it prime time. Those are the type of things that are increasing access, because the more people see this at 8 p.m. watching the news, and they see a 10-second, 30-second spot nationwide about, listen, anxiety, pain, depression, come to a clinic. It doesn't have to be ours, of course, but it's a partnership. And let's figure out a different alternative. So I think that's something that we couldn't do before. Now we're able to do that because of the rate. And the more, like countries like Israel, like we're saying, Thailand, all these start to talk about it, the more people will read it in the news, and the more open they will be to that. I think it's going to be, of course, a big challenge. But just to think about nationwide ads or inside the Colombia CNN being able to say, hey, starting tomorrow, more than 4,000 to 5,000 consultations for medical cannabis. That's something you couldn't think about before. So, the more patients are talking about it, and particularly with the force of social media, I think we're seeing that access, that conversation happening with all age groups. In fact, for example, in our clinics, most of our patients are above 65 years old. So they are the ones who are leading that because they don't want to keep, spend the rest of their lives hooked on opiates.
Well, it looks like Latin America is ahead of Europe, to some countries at least. Oh my God, I'm impressed. It's true. Jay, how do we break the stigma, especially going around the past few years, developing these businesses in so many countries? But you were in Africa too, I remember. So how do you break the stigma, or how do you get part of the culture?
It starts with education. We live in Italy, right? So what we do, we spend time in the US, we're in Italy. And and the demand is great in Italy. The issue is the access, right? Obviously it's a program that goes through the military. But people want cannabis in Italy. But Europe, and I would imagine same problems you run into in Africa and South America is education, and it has to start at the top. You're not going out immediately to educate the consumer, but you have to start with, everybody from the ministers of health down to the universities to the pharmacist. The consumer trusts the pharmacist. He trusts the doctor. He doesn't trust specifically the company that comes in and says, hey, this cannabis works, and use it because we say so. So, you've got to start programs to really educate the medical professionals, and then the medical professionals will go out and spread the word on how good a product is as compared to other things that are over the shelf or prescribed by doctors for the past 20, 30 years based on trials and clinicals that have been run in the past. I mean, we are a young industry. So we need to get out there and we need to educate, and it starts at the top.
We have only a couple of minutes, but so on the same topic, without switching, I was going to ask other questions. Oren, same thing, education, right? How do you educate? Of course, you acquired all these chains of the clinics. So in Israel, that's pretty straightforward, but also in other countries you're going to Germany, obviously they're very welcoming, in Canada. But what's your point of view?
So in Israel, cannabis, there is a research about cannabis in any university, any hospital in Israel. So it's well known, it's out there, people are talking about that. I think that it's completely different than what it was a few years ago. And for example, in Germany, what we have done, we took all the clinical data that we collected and all the know-how that we collected for so many years of working directly with patients and be able to collect this data. And we build educational materials out of that, especially for the market, especially for professionals, because the professionals are not professionals in cannabis. They don't have the clinical experience in that. So this is exactly what we are doing. And I can tell you that there is a great need for that. And we can see the feedbacks in Germany, for example.
Great. Thank you. Do I have 1 more minute or 2 more minutes? I don't know. It looks like they're not telling me anything.
About 1 more minute.
1 more minute? Can I? So, 1 minute, we don't do much. So let's just ask a simple question. Around the globe, we have Europe, Middle East, North America, Latin America, now Asia too. Where do you think the customers or patients are more knowledgeable nowadays, or more inclined? Of course, let's exclude the United States from this picture. And sorry, Antonio.
Look, in Europe, the estimates are that there are 90 million people that use cannabis on a regular basis. 20% of which, so 18 million, use it for self-medication purposes. So we don't need to create the demand. We just need to create the access, as Alvaro and Oren and Jay were saying. So we need to give the ability to explain what cannabis is to the professionals, to the doctors, and they are the ones who are going to prescribe when it comes to medical cannabis. The patients are there. People are using it. We are converting a an industry that was completely illegal for 70 years into something that is legal, but we're not changing anyone's habit.
Perfect. Thank you so much, Antonio, Alvaro, Jay, Oren. It was amazing speaking with you and sharing all of this news.